Good morning viewers and welcome to the teleconferencing session for the PG DHHM program. There is a slight change. Today we'll be mainly discussing about the materials management and equipment management. Earlier we had informed you that we'll be discussing the material management, equipment management as well as the financial management and budget planning. But today we will concentrate mainly on the materials management and equipment management, and as you know, the topic of materials and equipment management has been assuming very important position in the hospital planning and management and hospital day-to-day functioning of the hospital administration. And today I am very happy that with me we have Professor J.K. Das, who is the professor and head of the Department of Hospital Administration, as well as Professor of Epidemiology in National Institute of Health and Family Welfare, and is a very good friend of mine, very old colleague, and a lot of experience in the field of hospital administration. So I am very happy to welcome you here, Dr. Das, and as you know, you have been participating in this teleconferencing off and on, and for this batch probably this may be your first teleconferencing. In the past, the second or first? For this batch? This batch, yes. And you will be also happy to know that in the National Institute of Health and Family Welfare also runs a one-year distance learning program in hospital management. So coming back to the topic of the materials and equipment management, I would give a small introduction to the topic and then request Dr. Das to first cover the materials management, inventory control, and then after the break I'll mainly focus on the equipment planning and management. If you look at the hospital budget of any organization, especially the tertiary care or secondary level hospital in the country, be it a district hospital, be it a teaching hospital, you will see that nearly 25% of the hospital budget is consumed on materials alone. I am not talking of the equipment management here because that's more with the capital cost, and the consumables and running cost is a little separate. When we talk of the consumables alone, including the pharmaceuticals, the other drug material, and the drugs include all items including needles, syringes, catheters, gloves, all these things. So it's a minimum of 25% of the budget, and sometimes it exceeds also and goes up to 1/3 of the total hospital budget, which goes on the materials planning and management. So it becomes a very important cost center for the hospital administrators to focus on, because it has been seen that there is a lot of wastage in the purchase of the drugs and in the consumption of the drugs, and various problems crop up, which Dr. Das will cover in a lot of detail, and we will have discussions. In fact, I would invite all the viewers and the program in charges and coordinators to ask us the questions. Don't hesitate to raise any question during any time of these two sessions. We have only two sessions today, so try to make the most of it. And so this is about the materials. Particularly when we talk of the materials, the drugs are the most important consumable materials. So the discussion would be mainly focusing on that dimension of the materials management. And then when we talk of the equipment management, the situation is really bad. Today in the country, we don't have more than 40% or 50% of the equipment in working condition. So particularly in the government hospitals, and there is a study I am going to share with you the findings, which was done all over the country some time back, and so the situation of the hospital equipments, particularly in the public hospitals, is alarming, and really we have to be very conscious of the entire process of the equipment planning, including the selection of the equipment, the procurement of the equipment, the specifications of the equipment, because as you know, the hospital equipments are based on high cost, expensive and sophisticated technology, and we have to be very careful. because these equipments are really very expensive and very delicate, and if we are not careful about the selection, specification, procurement, and so many other things, including condemnation and disposal of the equipment, because it has been seen in the hospitals that you have been working or you have worked earlier, that the precious little space in our radiology department or in laboratory services is occupied by the equipment which have outlived their life, and we have not properly, we have not taken steps to condemn them and to dispose them off. So they are occupying the space, they are inviting audit objections, and the whole ball game of the hospital equipment management, whole scenario of the hospital equipment management is really another concern and a challenge before you, how to improve the existing situation. So with this introduction, I would now request Professor Das to discuss about the materials management and inventory control. And please, again, I will request that you must let us know that where you are and how many of you are present, which centers you have assembled, ask questions, and we'll be very happy to answer those questions. Professor
Exactly.
Das, yes.
Good morning, viewers, and welcome you all. First of all, let me add two more things in my introduction, which Professor Agarwal missed it. That Professor Agarwal is not only my teacher, he is the mentor also, and whatsoever I am here today, it is mainly greatly because of him only. Well, friends, our time is not that enough, and I cannot go on discussing all these things because we have got so many things common in between us, and these two programs which he was telling that we are also having the same program from NIHFW. He is the person who started it there also, and now I am just continuing with that. Well, friends, coming to the topic of materials management. Well, you have already got a very good introduction from Professor Agarwal. So now, when we are talking about materials management, so materials management usually maybe divided into means when we are managing our resources in any hospital, we are mainly concentrating on that famous 3 M's, that is man, money and material. Man, the human resource; money, that finance; and the materials. Now materials can be broadly categorized into 2 things, that consumable items and capital items, and today I will be more concentrating on the consumable items, and Professor Agarwal will be taking care of that capital equipments. So friends, consumable items, as you know, these are the consumed, hence as a result these are coming under our recurring expenditure, one of our recurring expenditures, and as you all know that when we talk about our recurring expenditures, usually the recurring expenditures are done primarily in these 3 or 4 heads. First is the salaries in any of our public sector undertaking. It has been seen that out of our total recurring expenditure, almost around 70 or sometimes more than even 70% of the budget is spent on the salaries only. Consumable takes care of around 30 to 40%, and out of which medicines and drug items, they consume 50% of it. That means almost it comes to 1/5 of our total recurring expenditure in a hospital is spent on your drugs and medicines. And third is your overheads, that means repair, maintenance, payment of the bills, payment of taxes, so all these things comes under it. And it is not only that in our consumables that we are consuming almost 1/5 of our total recurring expenditure on the drugs and medicines, but this materials management or for running a hospital, these are our strongest kind of ammunitions available with us. Because why I am using this term? Because this concept of materials management, actually though we borrowed it from the industrial sector, and that is why we call them materials management, as they are also telling it, but the main science and art of this materials management actually came from army sector, where they use the term known as logistics and supply management system. And in the logistics and supply management system in army, the first and foremost thing they require are the arms and ammunitions, almost similar kind of things which we require in our hospital functioning, that is our drugs and medicines. Well friends, I am not going to the further details of it. Let us come or concentrate on this materials management. As per the definition, the materials management, it is all given on your the what in the study materials. That is, materials management is a scientific technique which is concerned with planning, organizing and controlling the flow of materials from their initial purchase through internal operation to be distributed to the service points. Now, why we require this materials management? Mainly to have the materials on hand whenever it is needed. Second, to pay the lowest possible price consistent with the quality and value of the requirement. That doesn't mean that lowest price means whatsoever available you just take it. It should be in consonance with your quality and your value requirement. Third, to minimize inventory investment, and fourth, operate efficiently. Friends, please remember these are the four things which are the crux of our materials management, and these are the things we need to address to when we are talking about our materials management. Now, as I said, that main aim of the materials management hence is to get the right thing and the right quality and quantity of the supplies at the right time, at the right place, and definitely of course at a right cost. And it aims at the maximizing the availability of the materials within your given resource constraints. Resources are always deficient. They are always be there the constraints. So within that constraints, you need to arrange the maximum of those things of that without compromising with the quality, but at the lowest cost. And friends, I hope I am not telling anything new in it, because it is not only that the materials we are discussing about for the hospitals, but it is any material you are procuring for your home also, for your day-to-day requirement also. I think you follow absolutely the same thing. You need to find out what is that item you need to buy with that proper justification, why you need to buy it and to what quantity you need to buy it. Having some quality input into it, quality aspect into it, you should be addressing that. Well, this item should be of this particular quality only, and you will see to it that those items should be available as and when required. So these are the things you are also doing for your home. But how scientifically we can really arrange it, that is what we will be discussing now. Now, the materials in hospital can be broadly classified into three groups. That is the consumables, which can be used only once and then it is consumed, like drugs, medical gases, disposable syringe needles, reagents, kits, etc., etc. Second are the semi-durables, or in the army you are most commonly using that, expandable stores. Now, these are the items, because primarily we are differentiating between our consumable items and capital equipment as this. In the consumable items, they can be used after procurement only once and then it is consumed. But capital items are the items which after procurement can be used repeatedly but for a longer period of time. But you will find there are certain items in your store which after procurement can be used more than once but for a very shorter period of time. And these are the items which we also call them the semi-durable items, like these are the semi-durable items like surgical instruments, linen, glass, sorry for the spelling, rubber, plastic items, etc. Because these are your rubber catheters, plastics, plastic cannulas, then your surgical instruments, that is knife, scissor, forceps. So these are the items can be used more than once, but for a very short period of time, and the main difference of these items and the capital items are these items cannot be repaired. So hence we call them the semi-durable items, and the durable items are the equipments or the instruments that we usually call them the capital equipments, and Professor Agarwal will be taking care of that. Now this is exactly what Professor Agarwal was telling, that is the elements or the cycle of your materials management. Now whenever we are talking about our materials management, first and foremost we need to decide, that is, what is that item we require, that is your demand estimation. Now demand estimation should be coming from your user department, because it should never be from your store purchase department, because it is a user department who are actually going to use it, and hence they should raise this. And along with this demand, they should have a proper justification, and they should also clear-cut mention that quantity and justification should come from there, and also definitely they should give the exact specifications of that item, so that will help us in conforming with your quality. Now once you are having this demand estimation, next step is our procurement procedure. And you know, in our public sector there are some defined procurement procedures are there which are being guided by our general financial rule. But otherwise also this procurement procedure is nothing new. Even in our general financial rule also, the basic principle it says, without compromising your quality, at the lowest cost you need to procure it. And as we are doing for our home also, that you need to identify which is that item you require, then you need to have the exact specification which you will be having in that item, and based on that thing you will go for the cost of that item, and you will find out or take out that which is that firm or the supplier or the distributor who is offering you the lowest cost without compromising with that required specification, specific qualities or specifications. You will be procuring the item from him. After the procurement, it comes that receipt and inspection. Now for the consumable items, receipt and inspection, that means not only it is the quantity which you have asked for, but you need to see to it, like for example, if I talk about that drug items, in that condition you need to find out not only that required item, but those specifications, those pharmacological name or the generic name of that item, that salt composition of that item, then along with a quality control certificate of it, physical verification, and if possible some chemical analysis of it. But chemical analysis part is not that mandatory for us, because we are supposed to take up around 10% of the total stock items with us and send it for, randomly we pick it up and send it for the chemical analysis. But when you are receiving the item, you don't forget to examine that the distributor or the supplier is providing a proper quality control certificate for that thing. And another important aspect you need to examine in that is that shelf life period being available with you for these drug items. And usually every hospital should have their own policy decision for accepting the shelf life period. Usually routinely what we take is this: 3/4 or 2/3 of the shelf life should be available with you, so that these items should not be expired before you are actually consuming it. After this receipt of inspection, we go for the storage, and in our storage, that is, we need to maintain those things. It should have adequate space, that is the temperature control, humidity control, pest control, then proper classification of this item and storing that items, following of those FIFO rules, that is first in first out rules, that the stock you have received first, that will be consumed first, and the following stock which you are receiving should be taken up later. So hence that newer stock which you are receiving, that should be put at the back side of the stock, or that is what I mean to say is that just after that previous stock which you are receiving, so that you are not allowing that the stock which you are receiving now are being used and the stock which you have received previously are being put in the back side of the shelf and it is getting expired. So hence we need to take care of those, and then we need to maintain some documentation, some registers in the form of your that is the store maintenance register, that expiry drug register. So all those things you need to maintain, and I am sure that you people are aware of those things. And then as per the requirement of our various service units, it may be the OPD's pharmacy, or it may be the various wards, maybe the operation theatre or any other patient care area, as per their requirements they will be sending their indents, and that issue will be items to be issued. Now this next three things, that maintenance, condemnation and disposal, these are the things which we require for the capital equipments, because once we have issued and used for the consumable items, we are consuming it, and hence these things are not required. But for whole of this cycle need to be accounted, and information system should be there, so that you can do the proper evaluation, and whatsoever deficiencies, whatsoever wrong things been done in this whole cycle of this materials management, starting from demand estimation to the ultimate use of it, are to be evaluated regularly, and these are to be used for our next cycle. So friends, this is how we exactly go through this materials management cycle, and this is how we need to do it. And Professor Agarwal, if you would like to add anything into it.
I think it was a very lucid description of the elements or cycle of materials management, and this is true to every store, whether it is a medical store or it is general store or it is kitchen store or it's a industrial Maruti car store. So these are the elements which have in fact, as you rightly described, that the concept of the logistics and supply management has been taken from the armed forces, and similarly it has been extended to the hospital medical stores. And you know that it becomes all the more important in the hospitals, because we in the hospitals deal with the life and death question of the patients, and if we do not have the right type of the drugs or the vital and essential drugs, which is going to discuss very soon, then not only that, we are likely to have the serious repercussions on the lives lost or the permanent damage done to the patients because of the non-availability of, say, OT drugs or anesthetic drugs or oxygen. If they are suddenly out of stock, you may have to postpone surgeries, patient will suffer, and there will be a huge press coverage, media adverse media coverage against the hospital and the management of the hospital. So with a view not only to avoid these kind of situations, but also to improve the quality of patient care, it becomes very, very important that we must maintain adequate stock of all the vital and essential items and try to weed out the drugs and medicines which you see are of very little value, and that's what the inventory control is going to discuss. But as far as the elements are concerned, I think if you have any question, he'll be very happy to answer. Only thing is, remember that when he says demand estimation, we have to keep in mind, particularly of the drugs, that today in the country over the counter we have more than 100,000, more than 1 lakh drug formulations of various types, capsules, injections, tablets, and lotions, elixirs and syrups, whatnot, pediatric and all those things. More than 100,000 formulations are available over the counter. But how much do we need? The World Health Organization has given the list of the essential drugs, where they say that we don't need more than 300, 400 drugs totally, even in the tertiary care hospital. And they have classified the drugs according to their pharmacological actions, like anesthetic drugs, then the analgesics and antipyretics, the antidiarrheals, the anthelmintics, the antibiotics, all that classification has been done. But you see, it's a madhouse, it's quite a confused situation, that we have endless of numbers of the drugs which are purchased, especially in the hospitals which can afford to purchase them, and it's free for all, and that's very, very objectionable, because you see, particularly for the antibiotics, we must try to have an antibiotic policy. We must try to have a formulary of the drugs. Otherwise, what happens, not only the expenditure increases, but the misuse, abuse of the antibiotics leads to a situation that we develop resistant strains of microorganisms, and that's a very, very serious situation. I think these are some of the comments I thought I'd like to give here, Dr. Das.
Thank you so much, sir. And I think next step, because as I was telling, it is not only that the right item we are having it, but we need to ensure the availability of the item as and when it is required. And that is a kind of a real challenge, and that is what we need to understand, these concepts of inventory control. Now, while we are talking about inventory control, as per the definition, inventory is defined as the sum of the value of raw materials, fuel, lubricants, spares, parts, maintenance, consumables, semi-processed, high materials, finished goods, etc., which we are keeping in our store. That means, in one short shortly we can say that inventory is a list of items which we can count, measure or weigh and kept in our store, and from that thing you can say it. Now the question comes, how much of that item how much of the quantity of that item you need to keep in your store, by which you can always ensure the availability, but on the same time you are not going for any overstocking, and as a result of that it is kind of a expiry and wastage of your capital investments. And on the other hand, if you are not having enough stock available with you, most often you will go for the stock outs, and in a hospital situation, and if that particular item is a vital item, a life-saving item, in that condition it will be a very, very grave situation, because we are dealing with the life of the patient, we are dealing with the health of the patient. So hence inventory, for that matter, some people say it is a necessary headache, a kind of thing which you need to have it. Either if you are not having it, you will be in problem, and if you are having excess of it, that is excess for your own requirement, it will be a problem. Now the problem in hospital is this: next moment which is that item will be required and to what quantity it will be required, nobody can say. So under that uncertain situation, how can you ensure that items are always available? And that is what in our inventory control or inventory management is. Hence, if we go by this thing step by step, the objective is to achieve the inventory its objective. Inventory control must determine items to be stocked. What are those items to be stocked? Determine when and how much to be replenished. Keep suitable records and weed out obsolete items. It is also to reduce the financial investment in inventories, because as I said, whenever we are having some stock items, that means we are blocking some of the finance into it. To facilitate its operation, to avoid loss from obsolescence, and to improve the customer satisfaction. So I think all of you realize that what is the need of inventory. Inventory control is a scientific method by which an organization is supplied with the goods and services that it needs to achieve its objectives at optimum cost. Now this word optimum, as per the dictionary meaning, is economically maximum. That means with the lowest cost, the maximum you can have. Now without proper control of inventory, serious problems can precipitate related to manufacturing, marketing, revenue generation, customer satisfaction, etc., etc. In hospital, timely availability of the drugs and supplies may be affected, or if the stocked in surplus quantity, may be result in the loss of revenue. It is exactly same which I was telling. Now, what are the factors which influence your inventory? Two fundamental questions are how much to buy at one time, and second is when to buy this quantity. That is how much and when. And the answer is governed by the requirements, that is the number of expected admission, number of operation, number of procedures, tests to be done. So by this you can have this a rough estimation of it. Second answer is this: quantity in stock or on order. How much to stock, and at a time how much you should order. Then your lead time. I hope you understand this word lead time. Lead time is the time which you require from the when you are raising that indent or raising that procurement to actually getting the supply. That means when you are planning to have those stock in your store. That time gap is known as lead time. And there is another word, obsolescence. That is a very, very dangerous kind of thing. Sometimes we are having the item with us, but nobody is using it. And if we are not careful about the obsolescence of the items, it will lead us to overstocking in your stores, and which ultimately be due to the reason of consumption will lead to expiry and wastage of your capital. One small example I can give you. There were the days for your utilization. You need to have for anti-inflammatory. You need to have your Brufen tablets. Now over the period, Brufen tablet is no more used, and mostly we are using what you call that Nimolid. Now if we are still continuing with the Brufen tablet with us, result will be that Brufen tablets will not be used by your physicians, but every year you are procuring it, storing it, and over the period of time they are expiring and not being used. So that are the kind of things. So we need to keep a close, monitoring of our obsolescence of these items. As I was talking about the cost, now when we are procuring any item, we are controlling few of the costs, and these costs can be classified as, first is the principal cost or the purchase cost. That is the cost we are paying for procuring that item. That is known as our principal cost. Now worldwide you will find, or it is universal and coming from time immemorial, if you are procuring any item in bulk, the unit price of that item will come down. And that is one method. Everywhere we say that we must have the bulk purchase so that we can bring down the cost. Yes, it is a very, very good method for bringing down your cost. But friends, please remember, whenever we are buying the item in bulk, that means we are carrying a huge stock with us. We are incurring some invisible costs. And what are these invisible costs? And this is known as, collectively this is known as inventory carrying cost. And this inventory carrying costs include, first and foremost, that means blockage of your finance. Means when you are procuring in a bulk, maybe you are having at a lower price, but you are having a bulk, so that means a huge amount has been blocked into it. Say for example, you are going to market and buying one particular vegetable in a big amount. Say for example, that tomato. Now tomato in the market, it has been sold at the cost of 10 rupees per kg. Now if you are asking that what will be the cost of 10 kg, the vendor will say 10 into 10, 100, but instead of 100 he is telling 80 rupees. So you are saving 20 rupees from it. So with that temptation, you are buying say 10 kgs of tomato, paying 80 rupees to him. That means maybe you are carrying only 100 rupees to buy all the vegetables. Now out of that 100 rupees you have already spent 80 rupees. So the liquidity of money which you are having with you is no more with you. You are left out with only 10 or 20 rupees, and with this 20 rupees you need to buy all other vegetables which are required for your household. So now you will be in serious constraint to have all those things with us. So first and foremost, whenever we are doing a bulk purchase, we are blocking our capital. Second, whenever there is a bulk, that means you are requiring a larger space, more manpower. So all this transportation, so all these things will be required, and everything will be having some cost into it. Then whenever you are having a bulk, and if your rate of consumption is not that much, in that condition what will happen, all your this thing is that kind of thing that as I was talking about the obsolescence. So if that item is coming towards that obsolete kind of item, in that condition also that obsolescence value will be there. Whenever you are stocking any item in bulk, there will be chance of deterioration. So this deterioration will also, that wastage will also have some cost. And then one more thing which is common all across the globe, that is pilferage. And rate of pilferage will be higher if you are having a bigger bulk of your stock. And this pilferage not necessarily always mean that pilferage means kind of a stealing or pinching. It may be sometimes that the service providers, they may also become slightly more generous to give away the things. So these are the other aspects we need to keep in mind. Hence this inventory carrying cost is another cost. We must be careful about it, and we don't have any data available with us, but the industrial sectors say that we are spending almost 30 to 35% of our principal cost or the purchase cost per annum on inventory carrying costs. So keep that figure in mind, and that is how you need to find out that thing. Third is that if we are very much concerned about this inventory carrying cost, what will happen? We will not going for a bigger bulk. So we will be having always in a short procurement. Smaller quantity we are procuring at a time, and this may also lead you to many frequent stockouts, and these stockouts may also lead you some deep trouble, and not only that, life or health of the patient we may put them in danger, but sometimes what happens, we land up paying some extra excess cost on it. Say for example, that oxygen cylinder which you are having with you, if you are not having adequate stock with you, because oxygen is a very, very vital item, and suddenly there is a requirement, so many serious patients came in, and you are not having enough stock with you, you need to procure it from the market, maybe it is middle of the night. Well, in a big city you can have it, but friends, remember, on that time you are not getting the supply at the same rate under which the supplier is supplying you. You will end up paying some higher cost for it, and believe me, sometimes it may be double of that cost. So that is another thing, and that is another example I can give you from the cylinder only. Every household is having 2 gas cylinders. Why they are having 2 gas cylinders? Because they know gas is a very, very vital item for a household, and it is not only that one cylinder we are having, but another full cylinder we are carrying with us, knowing fully that inventory carrying cost for it. But as it is a vital item, we don't mind paying some extra cost for it, but still we are carrying it, because if we are not having enough stock with you, and if there is any stock out situation, you will end up paying some extra money to that gas vendor or gas supplier to get that cylinder. So why unnecessarily to take that? Fourth cost which we usually deal with is our ordering cost. Now every time you are ordering, you are incurring some cost for that. For every supply order, you are incurring some cost for it. It may be the cost of the postage, cost of the stationery, cost of your maintenance of the office, maybe some advertisement for your tender and all those things. So you need to decide that how much, if whole of your stock is been done in one single order, you will be having the minimum ordering cost, the maximum item available with you. But in that condition, your this value of inventory carrying cost will go up. And to bring down that inventory carrying cost, you need to have order at a smaller, at a frequent interval for the smaller quantity. And in that case, your inventory carrying cost will come down, but your ordering cost will go up. And that is that question I was, that is that thing which I was telling, that how much to order. And that can be done, or that is how we calculate scientifically, is that economic order quantity. That at any given point of time, how much of that quantity we should order, so that your ordering cost and inventory carrying cost matches each other. And there is a formula given in your book in which you are actually calculating that annual consumption of the item with that ordering cost of that item divided by inventory carrying cost and the unit cost. So the formula says 2 multiplied by your annual consumption of the item multiplied by ordering cost divided by unit cost into your inventory carrying cost, and under root of that actually gives you this economic order quantity. Now this economic order quantity for our purpose are not exactly befitting for us, because this economic order quantity does not carry your buffer stock, and second thing is this, we are not always absolutely sure about that consumption of that particular item, how much we are going to consume. So that is why we are not always or very strictly following this principle, but it always gives you that maximum stock limit in your store, that you can always calculate by economic order quantity. Well friends, another thing is this, that to make the availability of the item as per the requirement, for that we apply or we try to categorize our items in our inventory, in our stock, into various types. Like that is one classification is ABC classification. ABC classification is based on the annual consumption cost of that item. So out of all the items which are available with us, we find out that annual consumption cost for each particular item, and you will find some of the items are very costly and some of the items are not that costly. So if you classify all these costly items, you will find maybe say for example 10% of your total items which are at the top, which are having the maximum cost, annual consumption cost into it. If you club them, you will find that you are incurring almost 70% of your budget for procuring those only 10% of those costly items. Next, B group of items, and this is the A group of items. B group of items are next 20% of the items which consumes roughly 20% of your budget, and rest of the 70% of the items you will find they are not consuming more than 10% of your budget. So if you classify them, and what are the significance of this classification? That A group of items, they are only 10% in number, but they are consuming 70% of your budget. So this will be preferably with the tight control of the top level management, and as these are the costly items, so inventory carrying cost will be very high, because if you are buying them in bulk, you are actually cornering your costly resource of your finance. So hence these are the items to be always procured in the smaller quantity. So you will be having them in the smaller quantity. Let the ordering cost go up, doesn't matter, but never ever have them in a larger quantity, otherwise inventory carrying cost will go up. Whereas for the C group of items, these are the less costly items. So once you have decided to procure them, try to procure them in bulk, so that because these are the least costly items, that inventory carrying cost will not be that high vis-a-vis your ordering cost. So just to bring down your ordering cost, you need to buy them in bulk. Second kind of classification, what we do is this, as per the criticality of the item. That means as per the shortage cost of that item.
Dr. Das, can you just again tell us how to calculate the ABC items, as you said that we have the cumulative cost, and then, so can you just repeat that, how to find out which are A, which are B, which are C, and maybe criticality point of view, if we have some time, we can do it after the break
sir,
as well.
Maybe sir, actually that is the constraint of time, I was hurrying through, maybe
I know.
Next session we can discuss, and I was leaving them, let some questions come in while we don't know whether the people are, exactly, exactly sir. Now the second is that I'll take up that question in the next session. The thing is this, second is the VED analysis, that is VED means vital, essential and desirable. Vital items are those items the absence of which cannot be tolerated even for a single moment. These are the items, the absence you cannot, because these are the items like life-saving items, like soap and water, like gauze cotton. Not necessarily they need to be very costly, no. They may not be very costly, because you find that adrenaline, terifylline, these are not costly items, but they are the life-saving items. And at the same time, you may have some very costly items, anti-snake venoms, that is we are using the streptokinase. So there are certain items which are costly also. But what I mean to say is this, you need to identify these items and you need to categorize them. Essential items are those items, for a shorter period of time you can tolerate its absence. One particular group of antibiotic or one particular group of anti-inflammatory are not available, you can do with another one. Nimolid is not available for a shorter period of time, you can do with paracetamol. So those are the essential items. And desirable items, the items which are absent even for a longer period of time, is not going to seriously hamper your functioning of the hospitals. So these are your desirable items. So friends, these items you need to justify as per the objective of the institution. There is no mathematical calculation for it, no percentage. You need to justify as per your common consensus that which are the items to be kept in the vital category, essential category and desirable category.
Maybe yes. Thank you very much, Dr. Das. This brings us to the close of the first session, and we will have more discussions on the inventory control, particularly ABC VED analysis, which is the backbone of the entire materials management after the tea break. So come back, stay with us, and we'll see you at 12 o'clock. Thank you very much.